Dear students, welcome back. In the previous session, we have discussed about the male genital external organs, part 1. In that, we have discussed about penis. Now, in this session, we are going to discuss about another part in part 2, that is scrotum. Okay, the scrotum normally it is called as in Latin. The meaning is bag. Okay, the scrotum is a cutaneous bag containing a right and left testis. It is containing right and left testis, the epididymis and the lower parts of the spermatic cord. Okay, this is about the scrotum, and externally the scrotum is divided into right and left parts by a ridge or raphe. So by a ridge or raphe, which is continued forwards on the undersurface of the penis and backwards along the middle of the perineum up to the anus. Okay, so externally the scrotum is divided into right and left parts. Okay, right and left parts by a ridge or raphe which is continued forwards on the undersurface of the penis and backwards along the middle of the perineum to the anus. The left half of the scrotum hangs, so the left side one hangs a little lower than the right, which corresponds the greater length of the left spermatic cord. Okay, so under the influence of cold and in young persons, the scrotum is short, corrugated and closely applied to the testis. When the person is young and also under the influence of cold, the scrotum is short, corrugated and which is closely applied to the testis. Okay, this is due to the contraction of the subcutaneous muscles of scrotum. So that muscle name is called as dartos muscle. I have mentioned this dartos muscle, so which is replaced by the superficial fascia actually. However, under the influence of warmth, and in old and debilitated persons, the scrotum is elongated. So the scrotum will be elongated and flaccid due to relaxation of dartos. Okay, under influence of cold and in young persons, what will happen? The scrotum becomes short, whereas in the old people, so the scrotum is elongated and flaccid. Okay, due to relaxation of dartos muscle. So by seeing these things, the dartos muscle helps in a regulation of temperature within the scrotum. So this muscle plays an important role in the regulation of temperature within the scrotum. So that is the main function of the dartos muscle. Okay, now we will see the layers of the scrotum. The scrotum is made up of primarily from externally, it is by skin. The skin is continuation with the abdominal skin and dartos muscle. Next layer is the dartos muscle, which replaces the superficial fascia, and this dartos muscle is prolongated into the median vertical septum. So it is elongated or prolonged into the medial vertical septum between the two halves of the scrotum. Okay, next layer is the external spermatic fascia. So which is this fascia extends from the external oblique muscle, and next layer to this external spermatic fascia is the cremasteric muscle and fascia. Okay, this is from the internal oblique muscle. And then finally you'll have the internal spermatic fascia. So this internal spermatic fascia is from the fascia transversalis. Okay, these are all the layers of scrotum. Okay, so what are the layers? Skin. Normally next to the skin superficial fascia is present, but here the superficial fascia is replaced by the dartos muscle, and then comes the external spermatic fascia and cremasteric muscle and fascia and internal spermatic fascia. So the same thing we have studied about spermatic cord. Then these are the same layers which are surrounding the spermatic cord, isn't it? So the same thing. So after this, so a sac is present inside this, that is called as scrotal sac, where normally the testis, epididymis are present inside this sac. Okay, now if you see the blood supply of the scrotum, which is almost same as that of penis also. So here the scrotum is, if you see this, the scrotum is supplied by the superficial external pudendal artery and the deep external pudendal artery and scrotal arteries, scrotal branches of internal pudendal artery. These two branches are the branches of deep external pudendal artery and also cremasteric artery. So it is a branch of inferior epigastric artery. It is a branch of inferior epigastric arteries. So the scrotum is supplied by the external, superficial external pudendal artery, and next one is branches of deep external pudendal artery and scrotal branches of internal pudendal artery. So what are the branches again? Superficial external pudendal artery and deep external pudendal artery. That means both from external pudendal artery. One is superficial and deep, and next one is the branches of internal pudendal artery, that is scrotal arteries, posterior scrotal artery and anterior scrotal artery, and finally the cremasteric branch, so which is supplied to the cremasteric muscle, which is a branch of inferior epigastric artery. Okay, so the cremasteric muscle is also a layer of scrotum, so that one is supplied by the cremasteric branch of inferior epigastric. Okay, now we will see the nerve supply. So it is nerve supply is normally done by ilioinguinal nerve, which is a branch of L1, and genital branch of genitofemoral nerve, which is also branch of L1, and next branches from S3, that is posterior scrotal branches of perineal nerve and perineal branch of posterior cutaneous nerve of thigh. Okay, these are the nerves which supplies the scrotum. Okay, the anterior 1/3 of the scrotum is supplied by L1 of the spinal cord through the ilioinguinal nerve and the genital branch of genitofemoral nerve, and posterior 2/3 of scrotum are supplied by the segment S3 through the posterior scrotal branches of the pudendal nerve and the perineal branch of posterior cutaneous nerve of thigh. Okay, so here you can see this anterior 1/3. So this one is the anterior 1/3 and posterior 2/3. Okay, the area supplied by L1, this one is L1, and S3 was separated by the ventral axial line. This one is the ventral axial line. Okay, and the dartos muscle is supplied by the genital branch of genitofemoral nerve. This is about the nerve supply of the scrotum. If you see the clinical anatomy of the scrotum, so due to laxity of skin and its dependent position, the scrotum is a common site of edema. So because of its laxity of skin and dependent position, the scrotum is a common site for edema. Because of abundance of hair and of sebaceous glands also makes it site of sebaceous cyst. Here you can see this sebaceous cysts which are present on the scrotum. Okay. As the scrotum is supplied by widely separated dermatomes, that is L1, S3, spinal anesthesia of the whole scrotum is difficult to achieve. If the scrotum is bifid in male, then it is called as pseudohermaphroditism. Okay, so these are the conditions which is related to the clinical anatomy to the scrotum. In the next session, we are going to see the testis. Thank you.